Morning everyone, my name's Alf Collins and I'm Clinical Director for Personalised Care for NHS England and NHS Improvement. It gives me enormous pleasure to welcome you to this event. I hope you enjoy it. Personalised care is a coming together of concepts from social care to do with personalisation and choice, and concepts from healthcare to do with shared decision-making, support for self-management and health coaching. We brought them together purposefully in NHS England to demonstrate the integration between health and social care. Many of us, most of us, believe that we're already practicing personalised care. National surveys tell us that we could perhaps do better. Less than 4 people in 10 living with a long-term condition are asked what's important to them, what matters to them when discussing the best management of their conditional conditions. So there's more we can do. And the Personalised Care Institute is a national training development organisation that's been convened by the Royal College of General Practitioners. It brings together more than 40 national organisations, all the relevant Royal Colleges, all the relevant national institutions. And it's there to set standards of training, face-to-face training in particular, but it's also there to curate the great learning resources, e-learning resources that are already there, and to develop other e-learning resources for our workforce. The aim is that it reaches more than 75,000 health and care professionals over the next few years. We'd like to think we'll reach an awful lot more. The aim of it is to bring together training to do with shared decision-making, personalised care and support planning, self-management support and social prescribing. And in doing so, we believe that the Personalised Care Institute is going to help you make great steps forward when it comes to providing personalised care for individuals and for populations. You've got lots you can teach us. We want to hear from you. We want to learn from you. Meantime, enjoy today, and it's over to Martin Marshall.
Hi, my name's Martin Marshall. I'm Chair of the Royal College of General Practitioners and a GP in Newham in East London. Thanks so much for getting involved in the Personalised Care Institute. It's one of the most exciting initiatives that I've been involved in. You'll be aware that the Institute is a virtual training hub for health and care staff to access the very latest in personalised care training and development. We're offering a wide range of flexible and accredited courses from a range of providers, and the Institute will support professionals to gain knowledge, skills and confidence to provide personalised care to their patients. In addition, training programmes for existing and new roles identified in primary care networks are being developed, and the key focus of the Institute will be to quality assure and accredit programmes of training from third-party training providers. Today we'll be introducing our new curriculum, our accredited scheme for training providers, demonstrating our PCI e-learning hub, and our first e-learning course, which is Core Skills for Personalised Care. We want to encourage local and regional training providers, large or small, new and well-established, to apply for PCI accreditation so that health and care professionals can readily access your high-quality training provision. Today's regional launch is an opportunity to ask questions of our panel and to move towards our goals for personalised care together. I do hope you enjoy yourselves.
Hello everyone, and welcome to the regional launch of the Personalised Care Institute. My name's Pauline Foreman and I'm the Clinical Director for PCI. So there's just a couple of housekeeping issues before we get going. I just wanted to remind you that the event is being recorded and it's going to be posted onto the PCI website and potentially onto other social media sites like Twitter and also onto YouTube. I'd like to kick off really by introducing you to Zainab, a woman with lived experience of sickle cell disease who gives a very compelling account of the benefits of personalised care for patients.
Personalised care has made a huge difference in my life. Being able to have shared decision making and have support and care plans means that I can now live my best life. my name's Zainab Garbasani and I have sickle cell anemia. So sickle cell anemia is a genetic disorder that affects your red blood cells. So rather than being circle shaped, my red blood cells become sickled, which is basically the shape of a banana, in certain situations, such as when I am exposed to extreme weathers and temperatures, such as very cold or very hot temperatures, or physical stress. So the main symptom of sickle cell is severe pain. So this is called sickle cell crisis and happens when you have sickle cells blocking your blood vessels, and this can happen in your legs, arms, anywhere in your body. So basically sickle cell is a systemic disorder that affects all of your body. So I didn't really know about personalised care until I joined the personalised care group at NHS England, NHS Improvement. However, learning more about the work that they do, I realised I had had experiences of personalised care, and good personalised care, and also bad personalised care. The first day that I had a sickle cell crisis in Bradford, I was at university, I was on my own and I went to A&E because I was in severe pain. Unfortunately, because the consultants and the nurses at A&E did not know much about my condition, when I told them that I was in crisis and these were the things that I needed to do, because obviously I had lived my entire life with sickle cell and I became very good at knowing what works and what doesn't work for me, I wasn't listened to, and unfortunately that meant that in the end I spent 8 hours in severe pain in A&E without any painkillers or intervention. In the end I decided just to go home because actually I was probably better off managing my pain and what I was going through alone at home. The next day I called the haematology department and an amazing specialist nurse came to me, we sat down and we wrote a care plan. She listened to me about what works for me and what doesn't work for me. She listened what my needs were, what I wanted basically. And what it meant was that the next time that I had to go to A&E, I had a support plan already in place. So then I could tell the nurses and the doctors, this is my plan, this is what needs to happen. And that time, within 20 minutes, I was already seen. I had been given my painkillers, I had been given fluids, and I was already admitted basically. So having now experienced good and bad personalised care, I know what difference it can make. So I am very excited to be involved in the launch of the Personalised Care Institute, and I can't wait to see the impact it's going to make on many other people's lives. So having good personalised care means that your illness no longer has to be a barrier to your life.
So I think you would agree that that's a very compelling account of the improved healthcare experiences and outcomes that can result from good personalised care. I'm just going to talk you through where we are in terms of the Personalised Care Institute with our educational governance, particularly around the curriculum and the accreditation process, and then a little bit about our learning platform. So just to remind you really that the Personalised Care Institute is the main training resource for health and social care practitioners, and that's across all sectors. So that's primary care, secondary care, community, etc. So it's for everybody, and we have a very ambitious plan of supporting the training of a minimum of 75,000 practitioners in personalised care training by 2024. And this is how the governance works. We have developed training standards through the curriculum, and the accreditation process essentially ensures that they are actually put into practice so that individuals and commissioners can be certain that they're going to get a high quality assured training. We're very proud of our curriculum, which was launched on the 15th of September. It's a first in terms of being a curriculum totally devoted to personalised care. And basically it describes the quality standards, educational aims and high-level learning outcomes for delivering care, based essentially on the NHS EI comprehensive model for personalised care that I'm sure you're all familiar with. So the curriculum does a number of things. It unifies the range of approaches that are available to provide personalised care. And as I mentioned before, it describes the learning outcomes and educational aims for training and provides the framework for accreditation and governance. So there are three audiences essentially for the curriculum. One is individual learners. The second is providers or training providers who might be looking to accredit their programme, and the third is commissioners. So our philosophy is very much about building on existing foundations, on what works well, and we're really looking for a mindset shift. So a move from problem solving or what's the matter to you to a much more collaborative model of working with patients in terms of what matters to them. And we need to get that really as a prerequisite to changing professional behaviour. So I apologise that this is a slightly complex slide, but this sets out the curriculum structure. As you can see, we have core capabilities as the foundation blocks of the curriculum, and these are very much mapped to other curricula for medical and allied health professional training. So these are generic professional capabilities, values in personalised care, and then specific capabilities in personalised care. And then on the other side of the slide, we have the 6 components of personalised care as per the comprehensive model. So we've got shared decision-making, personalised care and support planning, social prescribing, supported self-management, enabling choice, and personal health budgets. But the models and approaches that sit between the two really help to deliver the components. And you'll probably notice that we have introduced remote and virtual environment, which was a relatively late addition to reflect the many changes that have come as a result of COVID. So just to remind you again that the curriculum sets out high-level learning outcomes. So it's set at a high level because obviously we can't set individual curricula for different professional groups or contexts within one document, but professional groups are welcome to develop their own syllabus based on the curriculum if they want to introduce additional learning outcomes. We have stratified learning levels so that we can take a flexible approach, and we have advice on how to learn, primarily through a blended and flipped learning approach. And we also have the standards of training that need to be met by providers. And these relate to course design, delivery, monitoring, and evaluation. So just a reminder about what accreditation means. It's essentially an independent validation of the quality of a programme of learning. And it really ensures that individuals and commissioners can access high quality training. So how do you go about getting accredited? Well, providers need to complete an application process, and they need to supply a range of evidence that relates to their organisational and educational governance and quality assurance. They need to map their programme to the curriculum outcomes that they seek to deliver, and they need to meet the training standards set out in the curriculum, as I've already described. Unusually for an accreditation process, they also need to demonstrate understanding of the learning needs and context of the professional groups and NHS systems they seek to deliver to. And that's really because training in and of itself, even if it's extremely good quality training, needs to be supported in practice. So systems need to be prepared to support learners to practice their skills if we're going to get the whole system change here that we're looking for. So this is just to show you what the portal on the website looks like. So we have lists of accredited training for commissioners and learners, and we have access to information on accreditation for providers. So I'm just going to move on now just to talk a little bit about our learning platform. This is the landing page for learners when they register and go through to undertake some e-learning. So although we are primarily an accreditation body, we also have commissioned some e-learning. There are already a lot of very good resources on personalised care training out there. So one of the first things that we did was undertake a scoping exercise to look and see what was already available. And we have curated those resources, and a selection of them are available on the PCI learning platform. And that's an ongoing process that we're still doing. We've also agreed our priorities for e-learning, looking for gaps. And these are the modules that we have prioritised for this year. Core skills, as you've already heard, is already live, and that's up on the website already. The next one that's likely to come out is shared decision making, which we hope will be live in the next couple of weeks, partly because it also at times with the new GMC guidance on decision making and informed consent. And we've also got modules coming on personalised care and support planning and understanding behaviour change and core skills. So in terms of the learning platform, learners are encouraged to register on the website so that they get updates on learning events and other developments. Our intention really is to develop an active community of practice via the website. That's going to take a little while to get established, but that's our aim. We will also use the website to undertake data collection on courses undertaken and to complete our evaluation. Well, thank you for listening, and I'm just putting up in case you don't already have it, our email address. We are a new organisation. We're very open to feedback, and please do feedback if there's anything else you'd like to see on our site. And I'm going to hand you over now to Jim to talk about working together.
Thank you, Pauline. Thank you for that overview of the curriculum and the accreditation. I just want to take a moment to take us back a couple of steps in a way and just refocus on, in a way, some of the thinking behind setting up the Personalised Care Institute and the whole need for training and development across the whole of the health and social care workforce. We know from the GP survey, last GP survey, that 40% of people didn't feel as involved as they wanted to be in decisions. And a large proportion felt that they didn't have enough to support to manage their condition, particularly their long-term health conditions, on a day-to-day basis. And I think there's been a real huge growing awareness around the biopsychosocial model of health, in that a lot of the things affecting health outcomes are outside of the control quite often of clinical care, but very much around social determinants of health, people's confidence, knowledge and skills to be able to manage their health condition, their level of health literacy or their level of activation. We know all of these elements sort of come together to sort of impact on best sort of clinical care and health outcomes. So personalised care really begins to sort of address these issues, and we have the 6 core components of the personalised care model: so shared decision making, supported self-management, personalised care and support planning, choice, personal health budgets, and social prescribing. However, what we also know, of course, is that all of those different elements, unless people are trained to be able to use them, they're not going to be used in day-to-day practice. It's just not going to happen. And what we also know that in terms of using things like shared decision-making, personalised care and support planning, and really coming along to a consultation or interaction with patients and citizens with an attitude around what's important to that individual. How can we orientate care based around what matters to them and what's important to them, requires a very different sort of conversation and a very different skill set. And it's very easy sometimes to think, well, I work in a person-centered care way, I work in a personalised care way. But we know when we observe people actually in consultations and things, and also sort of based on what people are telling us, there's a disconnect between people's perception of how they're working quite often and what is actually happening in that consultation. And those of us with a clinical background, etc., know that it's very easy sometimes in busy clinics and when we're pressed for time to slip into a fixed sort of attitude, and as it were. So what we're doing here is really for the first time putting in place a systematic approach to training. There's been a lot of confusion around motivational interviewing and health coaching and different models of consultation and behaviour change and what have you. And it's been really difficult for the workforce and people commissioning training to really understand what needs to be put in place. So the Personalised Care Institute really supports that, so that our regional expansion teams can also support the local system to really think through what are the skills, what are the training gaps that we need to sort of address to really ensure that personalised care happens and takes root. So supporting the health and care workforce to gain the new skills for this new relationship based on what's important to the individual and what matters to them. And that includes an understanding of how we communicate risk, how we share decisions around care, and how personalised care and support plans really include what matters and what's important to the person. So a focus on outcomes of greater choice, control and independence. We know if we focus on those, and that leads to a better quality of life. But also this is about aligning the national, regional and local priorities as well. We've got the universal model of personalised care, and the training and the Personalised Care Institute and the curriculum helps in a way produce a bit of a roadmap to enable those priorities to be aligned. And also, of course, as Pauline mentioned, to enable us to achieve our commitment in the long-term plan as well. There's one other thing I would quite like us to reflect on, is to really think around how we embed personalised care training. It's no good, quality training is brilliant. And I know from a lot of the training I've run over the years is one of the comments I get from people, you'll get an individual from a team and they go, well, this is brilliant, I really get this. However, my team or the environment I'm working in just does not support this way of working. So yes, training is vitally important, but we also need a supportive system as well. So this is around leadership in the system, managers in the system, thinking around how we enable personalised care to happen in the system as well. So we've got the whole concept of trained teams, what the Personalised Care Institute is focused on. But we mustn't also forget the whole area of the prepared public as well. How do we support people? How do we enable people to have the confidence, knowledge and skills to actually participate as an equal partner in shared decision-making conversations around really thinking through what's important to them and supporting them around that as well. So in a way, there's three legs to do this. There's the training the teams and training right across the care pathways, primary care, secondary care and social care, ensuring that the public have the confidence, knowledge and skills to engage in personalised care and work that way, and ensuring that the system is supportive of shared decision making, personalised care and support planning, health budgets, social prescribing as well. So again, as we begin to think of applying this at the local level and what support's available, it's worth bearing in mind those three sort of elements, as it were. And I bet mine is not. Excellent, it's working. So, in terms of local support, I guess there's three. Again, we're definitely on the rule of threes today rather than the rule of six. So we have a Personalised Care Group regional expansion teams. I'm really pleased that Trudy, who heads up London, is here to answer questions a bit later. We also have the RCGP Personalised Care Champions who are available, and again, you heard Mohan introduce himself earlier, and he's here for the Q&A. But also we have Health Education England training hubs as well as centres of training, and we'll be hearing from Harminder in a little bit around the role of Health Education England training hubs. So there are quite a number of local resources. Please make use of them, and they will really help you to understand, you know, with your local systems, what training is available locally and how to sort of develop that support around ensuring that there's coordinated training across the local system. Just thinking for a moment around some of the new roles in primary care, for example, care coordinators, social prescribing link workers, health and wellbeing coaches, first contact physiotherapists and things. No reason why they all cannot sort of attend the same training and core skills for health coaching, for example, and some of which is laid out in the core curriculum around level 1 and level 2 engagement, enabling and communication. It's well worth thinking around using a curriculum to think around what are the common elements around training across some of the different staff groups to really sort of get sort of value for money when commissioning is being trained. Okay, I'm going to stop there because we want to leave plenty of time for questions, but I'm going to hand her over now to Harminder Baines. Hi, Harminder, who's going to talk around the Health Education England training hubs.
Thank you, Jim. Hi, thank you for getting to speak about training hubs and the role of training hubs within Personalised Care Institute and the Personalised Care agenda. There are two distinct objectives that I want to be able to deliver as part of my talk today. And the first one is, what are training hubs? So what are they? Where they're based? How do we get contact with our training hubs? And the role that they play with driving this agenda forward. So I've got an animation that I'd like to play, and then I will describe the role. So if we can go to the animation, please.
Health Education England's training hubs are integral to our core purpose of helping deliver excellent healthcare through education and training to our current and future workforce, meeting the priorities outlined in the NHS long-term plan. They are based in primary and community care to serve the local community. By focusing on healthcare priorities, training hubs, in partnership with other educational providers, such as universities and primary care schools, will facilitate or provide training and professional development opportunities for the workforce of today and of the future. Training hubs work with key stakeholders such as primary care networks, sustainability and transformation partnerships, STPs, and integrated care systems to enable educational transformation that is right for the local area. Training Hub's core role is to increase placements by working with educational providers to ensure there are quality learning environments, facilitate student placements in primary care, such as GP practices, to allow learners to gain more exposure and experience. Support the promotion of primary care as a great place to work at all stages of career development from school onwards. Act as a single point of contact for workforce education initiatives in the area, making it easier for individuals to access information regarding education and training. Work with NHS England and NHS Improvement to help retain staff throughout their career from start to finish, for example, through the fellowship programmes. So how can training hubs benefit you? They enable and facilitate new and existing roles in primary care as part of a multidisciplinary team, to include roles such as physician associate, nurse, social prescribing link worker, and clinical pharmacist. They can help to facilitate training clinical staff to supervise or mentor students on placements. They support the development of the multidisciplinary team, and they support the facilitation of CPD of the workforce working in primary care. You can work with your training hub to identify opportunities to upskill, which will ultimately benefit the care your patients receive. For more information, please visit www.hee.nhs.uk www.ecc.org/ourwork/training hubs.
Fantastic, thank you. So just a couple of thoughts on the back of that animation. For me, the things that really kind of I want to share with colleagues that have joined the webinar is, training hubs are a single point of contact for education and training within primary care. So they are based in the community, serving the community. So they are best placed and have the links with primary care and therefore the workforce. They work on workforce educational interventions and our spaces around the educational transformation of the workforce, not the recruitment. This slide that I've pulled together is really kind of just displaying the connection between policy. So we're pushing the personalised care agenda because there's some good practice out there, but we can do more. But for me, in terms of primary care and the educational piece, we were cited in the people plan in terms of a rollout of primary care training hubs, and you'll notice there's a full rollout of training hubs, because we have got STP level training hubs, but they are at different levels of development and different stages of maturity, to use one of a better word. So what that means is there is an STP level training hub within your area, and the ones in London are quite established, and I would urge anybody on the call wanting to make contact with their training hub is to link in with your local office lead within health education, and the details will be found online. So if we can go to the next slide, please. So for me, a training hub is responsible for the education of the primary care workforce, those pre-qualification and post-qualification. And what I would say is they work across the STP area, so working with the system to establish the educational requirements, working with HEIs to identify learning needs and requirements of the workforce that are entering or in primary care and entering primary care. So they're in a really good position to really signpost the Personalised Care Institute and the curriculum that it has designed. If I can go on to the next slide. I'm not going to go into all of these kind of cells here that you can see in front of you, but for me there's something around working across the system, which I've described. There's something about making sure primary care is the best place to learn and really kind of driving the agenda forward around personalised care. The other thing that I'd like to mention is training hubs are being tasked to work on the continuum of professional development for primary care, which is another national government commitment that every nurse and AHP in primary care will have access to CPD. Again, that is an opportunity to offer personalised care curriculum to individuals within the sector. There will also be a part to play with curriculum design with universities. If I can go on to the next slide, please. For me, it's about having the conversation around new programs that are required within primary care, and to actually then have the dialogue with the educational providers, HEIs, further educational, private training providers around the offer. Some training hubs, not all of them, have a delivery arm. So some training hubs will seek PCI accreditation and can deliver the curriculum out in the system. Others don't have that remit and that function, and will be able to facilitate and signpost that training. So I wanted to leave it there, and again, thank you for your time, and look forward to a long and fruitful collaboration on this work. Thank you.
Thanks very much for that, Harminder. Certainly look forward to working more closely with the training hubs in the future.